first of all, I just want to say thank you so much for hosting me. It's a genuine pleasure to be invited to address your group, and I'm really thrilled to learn about the work that you are doing in your region. Um, and I'm grateful for the technology that lets us be together despite winter weather and great distances. So here we are. I am indeed a clinical psychologist. I've been specializing in hereditary cancer for a really long time, since I was a graduate student. And so what you're going to be hearing today is a mix of what we collectively, professionally have learned from doing research on psychosocial issues and hereditary cancer. But this also comes from me sitting in the room with many, many people who have grappled as individuals with being presented with risk information and all of the different ways that this lands in someone's individual life. You will hear a little bit about what I've learned from other people. I've presented at other uh, uh, conferences in this type of format. The sometimes the questions that I get then get rolled over into new presentations. So this is an ongoing uh, kind of life work that everybody helps co-create, right? And that spreads from one person to another to another. So I appreciate this opportunity. So let's start with an experience that you might all have. Oh, there's my disclosures. I have no um, conflicts of interest. And by the way, any photos that you see are not of actual patients. They are generic photos. So what I was going to say is one reaction that you may get when someone says to you, you have a what? You have a mutation? You're dealing with this? They've told you to have a surgery? What's going on? Is that they will look at you and say, oh, you're so strong, right? And so people will talk about, being put on this, what I call the resilience pedestal, as if you have, it's like you are always strong, always positive, and you have these people looking up to you. And it's as if, resilience is either some kind of magical property or that you're some kind of special hero because life has put this in your path. Whereas, truth be told, you know, uh, we become strong because that's what's in front of us, right? When life puts something in your path that's challenging, that's when we find out what we can do. So one of my favorite psychologists, Anne Maston, who's written extensively on the topic of resilience, the result of her research is that most people are resilient in the face of challenge, which means that it may not come about right away, but people do get their feet under them when they're facing something that seems overwhelming at the start. The other thing that she gets across is that resilience is a process. It's not something you're either born with or not. It's something you cultivate. It's something that you do. And I really love this quote that she wrote, that resilience doesn't come from a rare or special quality, but rather it's the everyday magic of our ordinary normative human resources. So if we take that out of psychospeak and put it into more relatable terms, basically what she's saying is that we have processes both in our bodies and our minds that allow us to meet challenges and to recover after a difficulty. So for example, if you think about if you get a boo-boo, like our little friend right here, right? First of all, it bleeds. then it starts to scab over and clot. Pretty soon you get that kind of dry skin, and in about a week you can't even tell what happened. Now, we don't have to teach our bodies how to recover after a cut. It happens. It's part of our built-in innate processes for recovering from wounds. We similarly have innate psychological processes that help us recover in the face of challenge. So basically, what I'm going to be doing today is to talk about what are some of the specific challenges that arise when you get a diagnosis of a BRCA mutation, or even if you have a family history that looks like you probably would test positive, and they can't find something, but you still have to treat yourself as if you are at high risk. In either scenario, what we're going to talk about is what does that put on your plate, and then what are some things that you can do to activate and cultivate these natural processes to help move things along. So I like calling this part of the talk, when we talk about challenges, learning the landscape, because if you're going to be traversing a set of challenges, knowing where the slopes, the inclines, the parts where the trail gets thin, being able to name what these are is part of learning what do you need, what tools you're going to need, what support are you going to need in order to meet the challenges. So let's go through a few of these. And not everything that I mentioned is going to apply to everybody, but I've tried to distill what are some of the common experiences that people have when they are facing familial or hereditary risk. So one of the most important ones is the fact that genetic inheritance is random. A BRCA mutation in particular is, the technical term is autosomal dominant, which means that if you have a parent with a mutation, there's a 50-50 chance each time for each child that this mutation could be passed on. Now, in scientific terms, we cannot explain who gets it and who doesn't. It truly is random. However, different people have different beliefs about orderedness in the universe, about things being fair. It may seem unfair that that something so important to your health or to the health of your children would be at random. Or you may have spiritual, religious beliefs that that do not that do not encompass things happening at random. But as far as we know scientifically, there's no way to speak to this. And so this grappling with the unfairness and what this means about how you view your world is a fundamental challenge of coping with a mutation with hereditary risk. Another thing is, if you've gone to your genetic counselor, is you'll hear lots of numbers. You have a 1 in 2 chance of inheriting the mutation. There's 1 in several thousand people who actually, have these mutations running in the family. But once you've fallen on the wrong side of the number and you're that one person, right? It kind of changes things. It's like, it can be isolating. How did you turn out to be that one? It does lead people to ask, why me? Out of all of these people, how did I wind up with that? And each person has to come up with an individual answer about how did you land there? And so sometimes people will have stories about that, like, my family's really unlucky, or, I look like my mom, so of course I inherited her mutation. So, and these explanations that we generate for how did we land there then translate into stories that then shape how people cope with the situation. So another thing that will happen is, especially for people who find out their mutation status in the process of getting an actual cancer diagnosis, is that there's a lot of ups and downs. People will say things, oh, there's a little something on your mammogram, but it's probably nothing because you're so young. Oh, wait, oops, we do need to do another ultrasound. Oh gosh, we have something, but I'm looking at your family history. There's probably nothing there. And so there are all of these cycles of hopes and then shocks that happen. So, a roller coaster is something that we get on for fun, but these kind of terrifying at times dips and steep climbs that we go through can be really stressful. Another thing that I think is important to acknowledge is that, once you've been diagnosed with hereditary cancer risk, is that you get a lot of options that are designed to uh, help you live a long and healthy life, with, surgeries and screenings and different things. But it's important to remember that, truth be told, none of these are ideal. None of these are things that people would want to do. Do you really want to have an MRI or a mammogram every 6 months? No. Um, but it's the best that we have to offer at the time. If we think about, 300 years ago, if you had an illness, people would put leeches on you, or they would make cuts and bleed you, right? So there's so much research going on right now in the hereditary cancer space that someday what we're doing now is going to look as primitive as leeches do to us in present day, but we're not there. We're here. So, you're having, people are putting choices in front of you that are difficult, but truly do represent the best of what we know now. And some of these choices involve, some pretty significant moving around of body parts. And you may have had the encounter with a doctor or surgeon who says something like, oh, well, we can take this and we can move this flap here and we can rearrange things. But we're not made of Legos. We're not made of blocks. We come into, we live as an integrated whole of body and mind. And so to have someone look at you and talk about rearranging and removing things can be a threat to that sense of individuality and integrity. So that means that as you go through deciding what to do about managing your risk, that there is this task of regaining that sense of being a coordinated, single, holistic entity in the face of this, sort of very different perspective looking at individual organs. Another thing that can happen, and this depends on how old you are and what you have going on in life, you're going along this way, and then either your cancer diagnosis itself or a genetic diagnosis comes this way, and the plans that you had may get knocked to the side. Now, sometimes they may get delayed for a little while. Maybe you have to put things off for 6 months or a year because you have a surgery. But sometimes there are things that you have to put off and you can't get them back. So, for example, someone who, I've had more than a few patients who get their BRCA diagnosis around the age of 40, and maybe they were, still working on, maybe I still could have a kid, but then they test positive and everybody's talking to them about, well, we really need to get your ovaries removed pretty quickly. Letting go of fertility can be very difficult. It's one thing to undergo natural menopause as your body sort of moves out of fertility. It's another thing to be the one that has your hand on the door and pushing it shut. So, a short way to explain a lot of this is that, given the unpredictability of cancer and mutations and all of the different things where people can tell you this will probably happen, but I can't tell you for sure, is basically that cancer does not color inside the lines. So we can tell you things like, well, your risk is going to start going up after a certain age, but no one can say, wow, you can live your life and date and do whatever, you're not going to get cancer until 47, right? So it just makes thinking about your future in a very different space. The other thing that happens, this goes back to the idea of unfairness, is that sometimes people can do everything right. You can eat acres of broccoli and be very fit and thin and still get cancer, right? And sometimes people will get angry about having worked really hard to protect their health, and then it wound up, quote, not being enough. One of the things I've observed psychologically is that getting a diagnosis, like a cancer diagnosis or a genetic diagnosis, I call it, it's like the earthquake that shakes the building. So anything that is strong stays standing, but anything that already had a crack in it, whether it's coping, levels of stress, other things that are going on in your life that maybe were, not that together, will get exposed or disrupted by the diagnosis. Sometimes, this applies especially to people who've had prior traumas, and that could be anything from chronic child abuse to a prior health problem. Somebody has already had surgery for a different health issue. Maybe they've been in a motor vehicle accident that was disruptive, or were the victim of a sexual assault. Is that the current shock of the diagnosis will reverberate or echo the prior trauma, and so it's almost like it sets up a resonance that makes both of them present and palpable at the same time. Another thing that happens is, people will have a lot of, feelings of, feeling sad, feeling stressed. But a way to understand kind of the emotional distress that happens is, we all have our coping resources and a typical stress level that we've lived with or have chosen. Like if you've chosen a high stress career path, or you have, a very busy family life. So what happens, say you exercise for stress relief, or you like to keep busy, but then you decide you're going to have a surgery. All of a sudden you can't exercise anymore, or and then at the same time you're distracted by going to lots of appointments, your routines are disrupted. So your coping resources decrease, your stress level increases, and then you get this little gap opening up that's just big enough to fall through. And so people who are normally think of themselves as pretty good copers, you get this stress gap opening up, and then people will say things like, I don't feel like myself, or I don't understand why I'm having such a hard time with this, because normally I'm okay. It's just this, having these two aspects move apart from each other that is just enough to kind of put you on a wrong foot. Lastly, we've all been through a collective stressor in the fact of coping with the pandemic. So we all had to change our routines pretty drastically in terms of work, the hassles of, masking or isolating or monitoring yourself for symptoms, becoming more isolated. Everybody got a little more stressed, especially in the early periods of not not getting as much social time. And I can tell you that that first year, I felt like my practice just exploded. Especially my more vulnerable patients. Everybody who was already depressed or anxious got a little more so. And I think we're still in a process of recovery, but I think we've all learned a lesson that the solutions that we have in our lives, and the routines that we have, there's a temporary quality. We've learned that they are fragile, they can be disrupted, and that there are real consequences when that happens. So, given all of that, this is quite a set of challenges that we've gone through, but there are things that we can do to help ourselves get through the hard times. And I think the first thing is to recognize that resilience, unlike that kind of pedestal quality or the heroic quality, sometimes it's just not going to be pretty. You see these folks here, it looks like they went through some kind of natural disaster, up to their knees in mud. Some of their belongings may be salvageable, maybe they can be cleaned off. Some of them, they're just going to have to be tossed. It's just a slog sometimes to figure out what's going to work and what doesn't. But one of the things, when I talked before about, what are the things that our brains do? What are these natural processes that we have to help us recover in the face of challenges? There are two that are probably the most powerful. Number one, we do have the ability to recalibrate. You may not be able to control what you're able to do, but we do have control over defining what makes a good day. So for example, if you think about somebody who say was in an auto accident, they run 5 miles several days a week, and then all of a sudden they're in rehab and they can barely, walk to the bathroom and back. So, if they think about running 5 miles, a good day is far, far out of reach. But if you can define a good day as, well, now I can get all the way to the end of the hallway and back, that puts a good day within reach. So whatever it is that we're going through, we need on any given day to be able to make a little bit of a stretch, have a success that's possible, take credit for it at the end of the day. And that flexibility allows us to keep recalibrating how to kind of stay positive in a way that is not, kind of a Pollyanna or putting pretty wallpaper on a crack in the wall, but that has real meaning behind it. The other thing, now I don't know, anybody who's had an intro psychology course might recognize, excuse me, I'm having a little tickle, the Gestalt figure. If you look at it, it either first looks like a vase or it looks like two faces looking at each other. And then once you've seen one, it'll, excuse me. Once you've seen one image, it will flip to the other. That's something our brains naturally do, moving things from background to foreground. So, and this is a true basis of resilience, because there's a certain point where you start to think about what are the things that you can't do anymore because you have risk, or what are the things that are being at least temporarily put out of reach. People do start to refocus from what you can't do to what you can. I can never promise somebody when that's going to happen, but I can tell them it's a natural characteristic of our brains and it will happen at a certain point. So here's an example I like to use. So there was, when I was still living in New York, I was doing some tutoring, and I was working with this 8-year-old girl, and we were working on reading, and I discovered she really liked art. So I'm like, okay. And I found an art book, and we were reading about Matisse, and we read this story about in his late old age, he became too ill to paint, but he still had that creative urge. So he had an assistant, and he would cut these pieces of colored paper and develop this technique that we now know of as collage. And with the assistant's help, was able to create these pieces. And some of his most beloved and famous pieces of art come from this period of time. So, after we read that, I said, okay, so if you broke your arm, and she's what, 9? Tell me what you could not do if you broke your arm. You couldn't cook, you couldn't paint the walls. I think they were doing some kind of renovation in their apartment. Couldn't hang stuff up, you couldn't do sports. And I said, well, what could you do? And she said, well, you can pour water in a cup. Yes, you can, right? You can walk, you can still paint stuff, but it'll be different. You can use your phone, and you can see, well, I asked her, if you think about how would you feel when you think about what you can't do, you feel sad. If you think about what you can't do, you feel happy. She's 9 years old, and she's a full-blown cognitive behavioral therapist. She got it, right? So this is the shift that can happen over time. One of the things you can do to kind of help yourself along to get there is to use what I call positive self-coaching, saying things that are real and true that can be reassuring. One of the most powerful one of these is a very famous one day at a time, right? Looks great on a coffee mug. It's so ubiquitous that, you scarcely notice it. But in a time of struggle, going through a surgery, watching someone else go through a surgery, or becoming ill, this becomes a very powerful way to break things down enough to be doable, right? And sometimes that's the task, is how do I make today livable and doable? But then you can start making up your own, right? So one of my favorites, this is a good one for people who are experiencing, say, fatigue, either treatment fatigue or post-surgery. If you can't do a lot, do a little. If you can't do the full sink of dishes, wash, 2 mugs and a plate. Once you get started, you might do a few more, but it's a way of breaking the task down. When I first moved to Cleveland, I was pretty overwhelmed. I'd been living in New York for 20 years, and now all of a sudden I'm in this big hospital again. I have to learn to drive again after 20 years, and it was kind of a scene. And then this became my catchphrase that I made up. Every day, another piece falls into place, like, oh, I made it to the lunchroom and back without getting lost. That's terrific. Now I might want 5, but I get 1, right? So it took a while of one day after another, one piece falling into place after another. And I had to coach myself along. Hey, yeah, you're going to be okay. Another one that's really good to help engage with your medical team is, I'm in good hands, right? This is a good one when you're facing a stressful scan, is if you have confidence that regardless of what happens, you're going to have a soft landing on the other side, because you're connected to people who are going to know what to do. It's real, it's true. It doesn't sugarcoat the anxiety, but it can be enough to get you from here to there. Reducing hassles is a really good thing that you can do for yourself. There's research that shows that small hassles, the stresses of getting through your day, are strong drivers of mood, particularly anxiety and depression. So if you think about what are things that you can simplify, especially if you're having to go to more medical appointments than usual, which means that you're trying to either juggle your work schedule, juggle your childcare. When I was going to the office regularly, I'm all virtual now. I had 5 pairs of identical black pants. That was my way of taking one little hassle out of my life. And then I would just change my tops every day. And, it just, it was a little action on my own behalf that my time mattered. And that it made a small, solid contribution towards my mental health. So let's just do a couple more. These are a couple of techniques that I call emotional first aid. There's tons of coping techniques and breathing exercises and things that you can find on social media and whatnot. But these are 2 that I think are effective in helping people deal with specific stressful situations. So the first one is this color naming. We can do it right now. Do it right where you are. Look around your room. Excuse me. Name 3 things that are blue. I see the blue on my phone, a blue pen, and a blue sweater hanging over here. Now name 3 more things that are not red. That white paper, my black chalkboard, the green on my notebooks. What happens is we're trying to pull your attention out of the anxiety centers that are firing away up into, especially with that second action, naming 3 more things that are not a color, into this forebrain area that is our organizer, right? And that by shifting into this part of the brain, it's enough to disrupt an anxious train of thought. It's a really good one for sitting, when you're in the doctor's office, they've got you, in the gown, you're freezing, and you're waiting for them to knock on the door and they haven't done it yet. This is a good one. The second one is good for basically accepting difficult feelings. So when we get anxious, sometimes we're tempted to push anxiety away, tell ourselves not to do that. It can actually spiral. Like sometimes if you notice that you're anxious, you start taking deep breaths, they don't quite work, and then you get anxious about the fact that the deep breathing isn't working, and then you've got thoughts chasing thoughts, and you're off and running. So with the breath brush, what you would do is take a normal breath and then imagine that the breath can travel inwards and it can find a sensation of anxiety. So maybe your chest gets tight or your throat gets tight, and the breath just brushes over it super lightly, like a feather, or the way that you would stroke an infant's forehead very, very lightly. And just let that happen a few times. We're not trying to make the anxiety go away or do anything to it, just brushing over it. And try that a couple of times. Sometimes one will work more than the other for different people because we're all wired differently. But I would try both of them out and see if any of these are helpful to you. So just a couple more things. This is a really important point, especially when you're facing something that, like we said, things that you really don't want to have to do. Like if you're deciding that you're going to go ahead with a surgery, is being able to say in a sentence what this decision is going to do for you, and being able to make it yours. Even if everyone else is telling you have to do something, it's not until you make it yours that you have a reason that connects you. It connects you to other people. It connects you to things that are important to you, your values, your goals. And having that sense of meaning can help carry you through some of the hard times, the roller coaster, the ups and downs of getting through a procedure or other difficult times. So kind of in conclusion, one of the things that I have learned over the years is that the Getting a genetic diagnosis is basically an immersion in what I like to call the other facts of life. And it makes us think about things that are true of everybody without exception, but you've been pushed to acknowledge them in a way that most people have not been pushed. We are all subject to random events, not just some of us, not just people who are mutation carriers. Everyone has less control than they would like. We're all pushed to make decisions without knowing how they're going to turn out. And we're all mortal without exception. So what having a cancer diagnosis or a genetic diagnosis will do is basically take away the blinders that we use that allow us to do things like say, see you tomorrow. In truth, if we were being truthful, we would all say, hey, see you tomorrow, asterisk, depending on what happens, right? But staying in that level of knowledge is difficult until you're pushed to it because your life has been taken as a sudden turn with a diagnosis. So, in conclusion, in the face of this, in the face of dealing with these facts of life, what do we have? Resilience is something that is our birthright, and it's something that we do, that we can create good outcomes by using our flexibility, by allowing that process of shifting from can't to can. And it's always now. And you can always ask yourself, what's one step that I can take to getting closer to back on track? So just to finish, I want to tell you very briefly about a patient of mine. She was 34 when I first met her. She had a very difficult childhood. There was physical abuse by the father early on. There was separation. There was alcoholism. And then her mother divorced the abusive father, and she had a stepfather who was great. And then much later, she discovered that she had inherited a BRCA mutation from the abusive father, right? So it connected her to him after these many years. And she had just found out she was pregnant when she got her diagnosis. So they had been planning on having 3 kids. She and her husband decided they were going to stop at 2. She had wanted to breastfeed for 2 or 3 years, but all of her doctors were, having anxiety attacks of their own about, if you're breastfeeding, we can't monitor you. And they looked at her pedigree and said, there are some early breast cancers in your family. We need to start screening you. So she had to wean much sooner than she wanted. And after all of this and going through a bunch of, pretty extensive therapy, and not everybody needs this, her conclusion was that BRCA lit up every dark corner of my being. We explored all of these different aspects of herself. And what she took away was a sense of new confidence that she doesn't have to be afraid of her bad feelings, of feeling sad or fearful or angry. And she learned to trust herself in making decisions so that her own answers about what surgery to have, in what order, was a real and good answer for her. So with that, I would like to say thank you so much for your kind attention, and I would be happy to take questions that have shown up in the chat.